So, today our topic of discussion is the sternum. So, the sternum, it is also known as the breastbone. So, the sternum, it is an elongated flat bone that lies in the anterior and in the median part of the chest wall. So, what is the length of the sternum? The length of the sternum is 17 centimeter long. So, the sternum consists of three parts. Upper part called the manubrium sterni or the episternum, the middle part called the body or the mesosternum, and the lower part called the xiphoid process, also known as the metasternum. So, the sternum, it looks like a dagger or a small sword in shape. It has three parts called the manubrium, body, and the xiphoid process. So, the sternum is just like a dagger. So, the sternum, the three parts, that is the manubrium, body, and the xiphoid process. Manubrium represents the handle, the body represents the blade, and the xiphoid process, it resembles the pointed tip of the sword. Now, the upper part of the sternum, it is broad and thick, whereas the lower part, it is thin and it is pointed, because the tip of the xiphoid process, it is pointed. The anterior surface will be rough and convex when you hold, and the posterior will be smooth. The manubrium and the body, they lie at an angle of 163 degrees to each other. But this angle is not constant. This angle increases during inspiration and decreases during expiration. This angle is known as the sternal angle, and this sternal angle corresponds to the second rib. So, during surface marking and while locating for the apex beat and the area for the heart sound, the sternal angle is used as a important landmark for clinical practices. So, the manubrium. So, the manubrium, which is also known as the episternum. So, the manubrium, it is roughly quadrilateral in shape. It lies opposite to the third and fourth thoracic vertebrae. It is the thickest and the strongest part of the sternum, and it has the following features. It has two surfaces, anterior and posterior, and it has four borders: superior border, inferior border, the lateral border, that is right and left. So, four borders: superior, inferior, left border, and right border. Now, with the borders. So, the upper border, it is thick, rounded, and concave. It presents a notch called the suprasternal notch or the jugular notch. The jugular notch, it gives attachment to the interclavicular ligament. Clavicular notch on either side articulates with the clavicle to form the sternoclavicular joint. Sternoclavicular joint is a type of saddle joint. Now, the lateral border, it has two articular facets. The upper facet, it articulates with the first costal cartilage to form a primary cartilaginous joint, and the lower demifacet, along with the demifacet in the body of the sternum, it articulates with the second costal cartilage. The lower border articulates with the upper end of the body of the sternum to form a secondary cartilaginous joint called the manubriosternal joint. Now, this manubriosternal joint, it makes a slight angle with the body at this junction called the sternal angle or the angle of Lewis. When we use surface marking, so on the surface, it can be recognized by a transverse ridge or slight elevation on the anterior aspect of the sternum. Now, the anterior surface of the manubrium. So, the anterior surface on each side, it provides attachment to the sternal head of the sternocleidomastoid near the jugular notch and near the attachment of the first costal cartilage. It gives origin to the fibers of the pectoralis major. Now, the features of the posterior surface. The posterior surface, it is smooth than the anterior surface. and the posterior surface, it forms the anterior boundary of the superior mediastinum. So on either side, it provides attachment to two muscles. One is the sternohyoid at the level of the clavicular notch, and second, the sternothyroid at the level of the first costal cartilage. The lower half of the posterior surface, it is related to the arch of the aorta, and the upper half, it is related to the three branches of the arch of the aorta, that is the brachiocephalic artery, the left common carotid artery, left subclavian artery, and the left brachiocephalic vein. Now the next topic is body. The body of the sternum, it is also known as mesosternum. So the mesosternum is longer, narrower, and thinner than the manubrium. So it is placed roughly in the middle. So it has an upper end, it has a lower end. The upper end, it articulates with the manubrium to form the sternal angle, and this sternal angle, it is actually a symphysis, which is known as the manubriosternal joint. The lower end articulates with the xiphoid process to form secondary cartilaginous joint, which is also known as the xiphisternal joint. The lateral border, it articulates with the second to seventh costal cartilage, and these joints are synovial joints. The second costal cartilage articulates at the site of the manubriosternal junction, and the seventh costal cartilage articulates at the site of xiphisternal junction. Now the anterior surface. Anterior surface, it has three faint ridges which represent the lines of fusion of four segments, which are known as the sternebri. So the anterior surface, on each side, it gives origin to the fibers of pectoralis major muscle. Now there are four sternebri in the body. The ossification period. So the ossification center appears in the first sternebri in the 6th month, second sternebri in the 7th month, third sternebri at the 8th month, and fourth sternebri at the 9th month. Now we are talking about the posterior surface. The posterior surface, it is smooth and it is also slightly concave. The lower part of the posterior surface, it gives origin to the sternocostalis muscle, which is the muscle of the thoracic wall. Now on the right side of the median plane, the posterior surface is related to the pleura. On the left side, the upper part of the body, it is related to the pleura, but the lower part, it is related to the pericardium. Hence it is also known as a bare area. The lateral border articulates with the 2nd to 7th costal cartilages. Now the xiphoid process. The xiphoid process, it is also known as the metasternum. It is the lowest and the smallest part of the sternum, and it varies greatly in size. The tip provides attachment to the upper end of the linea alba. Now the anterior surface provides insertion to the medial fibers of the rectus abdominis. The posterior surface gives origin to the sternal fibers of the diaphragm. Please like, share and subscribe the channel, and thanks for watching.